everyone, and welcome to the show today once again. I'm glad to have you here for this month's episode on our series of interviews. And I am sure you're so expectant for today's episode because we've made the noise, we've shared the flyers, we've asked people to share and keep sharing because today's episode is going to be epic, awesome, whatever, amazing, everything you want to say it is. So we are welcoming you once again to the show by Thumim NG. And speaking to you right now is Dr. STM. I am fully known as Dr. Ifnaya Stelamaris Anyao, commonly known as Dr. STM from my middle name. And I am the host of this show here on YouTube. And today we'll be having a reputable Nigerian scholar, a physician, and the current sitting chief medical director of University College Hospital, Ibadan. And we are so happy to be here. If you're happy to be here, just drop some comments for me in the comment section. I just want to hear you. Make some noise, drop an emoji or something. I just want to know that I'm here with people. And I'm glad to really have you here today. With us for today, we'll be discussing, as you can see on the banner there, the title there, Medical Education in the 21st Century. This is a lot to talk about, and it's going to be an interesting one as we have someone who is there within the education industry coming to enlighten us, to answer our questions, to also share his own concern and everything about the current education trend within this generation, within this century. Before then, I'd like to bring up his bio. But before I get to start on his bio, please, if you've not subscribed to this channel, click the subscription button there and share. Like, make sure you subscribe. Just be with us because you get to get information about education, online courses, and we always drop it live there. Once again, if you've been here with us for since I don't want to say for God knows how long, but if you've been here with us for that long, we're just saying thank you. We are saying Eshe, we are saying Ndewo for always staying here with us, and we are happy to have you around today. Oh, thank you. I'm seeing the comments on the live chat. Nii Ajay said, great to be on board. You're welcome, Nii. And Dr. Yesiru said, good day. Hi, good day, Dr. Yesiru Adeyemi. We are happy to have you here today. And JOA is saying, hello all. Yeah, I'm sure all of you are here. You can't wait to see our guest for today. And our guest is no other person but Professor Jesse Abiodun Lubanjo Otegbayo. I just want to use a moment to talk about our guest before I get him in. You can see we have a handsome man there, and he's the best we are bringing for you on this particular topic. He was born in Sekondi, Ghana on 17th December 1961, and he hails from Otan Ile in Osun State. About his medical training journey, he got his MBBS from University of Ibadan in 1989, long before some of our visitors here are even born. And he completed his internship in 1990 at Obafemi Awolowo University Teaching Hospital Complex, Ile-Ife, and now went on to complete his National Youth Service, the compulsory youth service that every one of us do, in Nigerian Navy Medical Center, Delta State. The same year, he started his residency in UCH Ibadan, that's University College Hospital, where he is today the chief medical director. So you can see how life gets us along. Along the line, when he's doing his residency, he actually won the Basil Thomas Biomedical Foundation grant to study hepatitis B and hepatitis C in acute icteric hepatitis. Now, this is one out of the many winnings he had already gotten throughout his career. And shortly after that, in 1998, he completed his residency and obtained his fellowship as a member in West African College of Physicians, and that's about his medical training journey. Now, how about his journey to becoming a professor? So after he left, he just got his fellowship. He was appointed a lecturer as a lecturer one and consultant physician and gastroenterologist in the Department of Medicine, University of Ibadan, and the University College Hospital, the same 1998. By 2002, that's 4 years later, he became a senior lecturer. By 2005, he became a reader. And 10 years later, he is a professor. And many, like this is quite a swift journey, really, for what we are used to. Now, about his academic research prowess that have made this possible within 10 years and still going up, we just decided to select some so you can see who we have on board today. In 2000, he was elected into the Association of International Union of Cancer Fellows following his contribution to the research studies. And by 2002, he obtained a postgraduate certificate in gastroenterology at the University of Tel Aviv. 2003, he completed a master's degree in Chempath and immunology at the ULAND. And 2006, awarded the Fellowship of Research Microbiological Development for his PhD at the Laboratory de Santé Institute of Immunology, Luxembourg. Now, when we say we have a reputable scholar, you can acknowledge that right now. He also obtained his prestigious fellowship of the American College of Gastroenterology with the United States of America, the first in Nigeria, and that was in 2009. By 2011, that award he was given in 2006 matured, and he got his PhD award in 2011 from University of Ibadan. By 2014, he was awarded again the fellowship for professional exchange program in linguistics to study French in Ouagadougou by the West African Health Organization. Now, even before we continue, we can see that our guest today has been there in education, with education and serving as a scholar all the while. So I don't think we made a mistake in the person we selected to engage us today. So Professor Otegbayo has taught and served as an undergraduate and postgraduate examiner in several universities and hospitals in Nigeria, Cameroon, Ghana for MBBS, primary membership and fellowship exams. And he belongs to several local and international professional associations. He belongs to Nigeria Medical Association, the Medical and Dental Consultants Association of Nigeria, the Nigerian Cancer Society, the Society of Oncology and Cancer Research of Nigeria, the African Organization for Research and Training in Cancer, the Society for Gastroenterology and Hepatology in Nigeria, the European Association for the Study of the Liver, the British Society of Gastroenterology, and the American College of Gastroenterology. By now, I'm expecting to see so many clapping emojis on the chat box because this is not a small bio right here. And then Professor Jesse has attended and presented scientific papers across different continents. He has over 90 scholarly papers to his credit, available on research and scientific databases such as PubMed, PubGet, Medline, Biomed Experts, Lab Meeting, ResearchGate, Academia.edu, African Journals Online, and etc. In University of Ibadan and the University College Hospital Ibadan collectively, he has served in many committees and in many roles like admissions, ceremonial, medical education technology, executive committee, curriculum subcommittee, departmental postgraduate committee, Jaja Clinic Board of Health, Committee on Reorganization of Jaja Clinic, among others. And then again, he was the immediate past director of clinical services, research, and training. He was also the chairman, medical advisory committee, and a member board of management of the UCH. And on 1st March 2019, he was appointed the chief medical director of the University College Hospital, Ibadan, which he's currently serving as. And this is our guest for today, Professor Jesse Abiodun Olubanjo Otegbayo. Applause, people. Applause there in your comment section. Thank you, Prof. Welcome to the show today, and we are happy to have you. Your guests are all happy to have you here. See people bringing up their comments.
Thank you,
Emmanuel,
Salamaris.
thank you. Welcome to the show. Emmanuel said, greetings, everyone. A pleasure to be here. We are happy to have you, Emmanuel. Babatunde, hi Babatunde, and Comfort say, I'm here. Great, we are here too. We are all happy. Prof, just a welcome opening remark from you before we get it properly, formally.
Well, thank you. I want to appreciate the organizers for inviting me to partake of this wonderful thing that you are doing in medicine and other allied health professionals, because I've tried to look at a few things about your organization, which I don't even know the correct pronunciation. I can see TH plus MM, so I don't know how you really pronounce it. But just to say thank
Fumim,
you. What?
Fumim, THU, Fu.
Oh,
And
okay,
then,
Thumin.
yes, Fumim.
Okay.
Yeah.
So thank you
Thank
very
you.
much. I believe we all learn one or two things from this interaction.
Yes, thank you, Prof, for accepting to spend this time with us because we understand you're a busy person, yet you made that sacrifice to talk to our guests today and talk to our visitors. And it's not really an easy one. So, today, the discussion, as you can see there on the title, is about medical education in the 21st century. And while we are reading your bio, of course, we know already that your training, minus the recent ones that you had to go into fellowship and research, so many research activities, your training was significantly in the 20th century. So I think I'll start with a question of what do you think? What has changed from when you trained and the current training right now? What has changed?
So many things have changed. Uh, One of them, which is principal, is the availability of the internet, which has been a major that has been a major shift in medical education. When we were students, there was nothing like the mobile phone or the internet at all. And I remember when I was doing my master's, internet was just coming on board then, with a few people having desktop computers. There were no laptops or mobile phones. And I remember my supervisor then, late Professor Salimanu, he said I should go and do literature search at the Odeku Library of the College of Medicine. And there were these very, very huge and fat books called Index Medicus. Some of them as high as 25, 30 centimeters on the table.
Hmm.
And you have to rummage through, going through the index. And
Ah,
because I was one of the few lucky people who were earlier introduced to the internet. And he told me to go and search. And I said, Prof, sir, there's this place on the internet called PubMed that you can do a search there and it will give you all the details. They said, no, go to the library, get the index medicals, and I collected all these fat books. I was rummaging through. It was so laborious. When I couldn't get on with it, I quietly went online to use the PubMed and searched for all the things I needed to, and all these things were coming in a matter of seconds. So I pulled them together and I went to him and I said, I've done what you asked me to do. He said, yes, I told you Index Medicals is very good. Till date, I never told him till he died that I actually used. So those are the
I
things
used
that have changed.
PubMed.
Yeah, the patients that we take care of also have changed. Many of our patients are now enlightened. They have access to the internet on their phones, on their laptops, so they can challenge you. They can ask you difficult questions and take you to task. As at the time we were training, there was nothing like that. It's like the doctor is like a demigod. Whatever he says is final.
Yeah.
And of course, the level of education of the patient has also changed. Similarly, litigation was not common the time we were training. Now there's more of people trying to, charge you to court or sue you for any bit of malpractice or infringement of their rights as patients. So many
Yeah.
of these things are the changes that we have seen. And of course, learning now has become a bit easier, I would say, because you could get any fact. In fact, when you do work around with students these days, all of them have their phones. If you say something, they quickly check whether you are lying or you are telling them the truth. So you have to be sure you know your onions before you open your mouth to speak.
to
So these
speed.
are the major changes that are different in the 21st century compared to that of the 20th century.
Oh, thank you very much, Prof. While we were talking, people were still joining in. So let me just use the moment to welcome them in. Hello, visitors. We are happy to have you here today. And with us today is Professor Jesse Otegbayo, the Chief Medical Director of University College Hospital, Ibadan. And we are all happy to have you here. Speaking to you is Dr. STM, and we are on the platform Thumin. Just before we continue, I'll have to talk to you briefly about Thumim. Thumim is an online education platform, particularly for healthcare professionals. But of course, you will meet some of our teachers and our learners who are non-health inclined. But in Thumim, we have up to 15,000 healthcare professionals. We have doctors, pharmacists, nurses, med lab scientists, just healthcare professionals, both those who are teaching and those who are learning. And we also do online surveys. So we are there for medical, the health industry to make learning, to make online surveys easy for everyone. I can see Kehinde saying greetings to everyone. Hi, Kehinde, greetings to you too. Hello, guys. If you're just joining, you can also say hi or post a comment there on the live chat and we'll get to see it. Trust me, I'll be bringing up all other comments that came up here today. And while we were talking about the medical education in the 21st century, I asked our guest a question about what has changed from his time to now. Because while we were reading his bio, it was quite evident that he trained within the 20th century. He only became a research person. He joined like the 21st century as a research person, not like he trained within the 21st century. And the very first thing he described was easier access to resources, to learning resources. And of course, he mentioned about the improved health literacy of our patients, increasing litigation, and the rest. And I mean, every one of us is beginning to appreciate that because there on the social media, there on the internet, we are just dropping health education. You're getting so many information here and there. And that brings in the next concern about validity and reliability of information prior to the because mainly I know with most people talking, you always hear that them say that the main thing that has changed is the current advent of technology, which opens up spaces, opens up rooms for access to different kinds of information. And that's why you could even see people who are not trained come up and say that any sort of thing and start marketing something to people and they are buying. So people sometimes raise up this concern about validity or reliability of information. And it was quite evident during the COVID pandemic, where at some point the WHO, the NCDC, all concerned bodies had to start making a disclaimer that for appropriate information, please visit this website so that they know which one you are getting. With your knowledge so far, do you think internet is doing more harm or more good to information in terms of health literacy?
Well, thank you for that question. Personally, I would think the internet uh, is replete with so many negatives and positives. It depends on how you put it to use. If you are the type that is finicky for the right information, there are websites that are authentic, that are genuine, and that will give you the right information. You visit such places. In the alternative, there are some that are drawn up or written by charlatans, those who just claim to know everything and who know close to nothing. It now depends on whether you believe them or not, and for you to know the right places to search for medical information. So it's a two-edged sword, which can harm and can also heal at the same time. So it depends on where you belong to. But largely, for me, knowing where to get the appropriate information, it has been a very good thing for medical education.
Oh, I think I share the same sentiments with you because yes, in fact, most times when I'm to address such issue, I say for every society, there's always the good, the bad, and of course the ugly. So it's not surprising to also see such thing in the internet world, even within the research community. I think one of the best places that um, this internet advent had done wonderful things is in the research world, where you just described it for you. Instead of the 28 to 30 centimeter index medicals, you had to just go to PubMed and get what you needed. But at the
Yeah.
same time, people are still faced with predator journals when they try to publish their articles and the rest. So these are all the issues. And another thing that has become an interesting debate in education, especially medical education, one can decide to enroll into a degree program in a particular department and start and complete it online without having any physical interaction with their teachers or their fellow students. But that is not feasible with so far, with our environment, with medical education. Number one, do you think at some point in the future it will be feasible to completely teach medicine remotely without any physical interaction? And do you think there must be need for physical interaction when it comes to, let's just put it that way, when it comes to medical education?
I would say there will be no time that complete medical education will be obtained without physical interaction. Because there are some things that, even with artificial intelligence and robotic surgery, there are things that robots cannot do for you. There are things that artificial intelligence will not answer the question. There are things that modern equipment cannot attain unless there's a human interface. And because of that, there will always be the need. And in fact, if you look at the WHO definition of health, it's not just the absence of disease or infirmity. It's a state of physical, mental, and social well-being. How do you attain social well-being with computers or with robots or with machines? It's not possible. You see, human beings, when we are down or you are scattering, you need some people to hold you back together. A machine will never, never do that. The fact that you get to a patient and they break down in tears after relaying all their woes concerning the illness they have, a pat on the back alone, the holding of hands, if you see how much that alone does, you will know that there will also always be the need for that physical contact. But I must admit, such instances will reduce drastically because even COVID has taught us these things, that there's going to be a lot more utilization of the web to get information, and some, after getting all this, may even not try to see a doctor. They believe what they have read is sufficient, and truly, some of them read the appropriate site. Secondly, there may be a situation where you go into what is called telehealth. We now have telemedicine even in Nigeria, but that is to teach. But telehealth itself encompasses much more than telemedicine, where through the internet interface, you can do a consultation, but you can't do surgery uh, online. It just has to be man to man. I can't train people how to operate. And, not just, I'm using surgery as a model because it is more physical in terms of manual dexterity that you need to attain before you can practice. So, but of course, I must say that there will be a lot of use of simulation. These days, we have mannequins that can talk, that can answer to your questions when you talk to them, that can breathe. In fact, in 2002, when I was in Tel Aviv, I went to learn about advanced endoscopy, gastrointestinal endoscopy. And the first 2 weeks I was there, I was not even allowed into the clinics or the ward or anywhere. So I was taken to a four-story building. They called it their clinical skills laboratory. Everything about endoscopy was there. So they put me in front of what they call bionic simulators because it can talk. If it's feeling pain, it will tell you, you are hurting me, you're hurting me. And when you do the procedure, it will not do a computerized analysis of your success rate, your visit, the view, which is supposed to be 100%. It will tell you whether you scored 50, 60, or less. It will tell you how many times you caused harm to the patient, and it will tell you what to do next time to avoid such things. This was in 2002. I tried to duplicate same in usage. I talked to the former CMD, but there was no money to do it. Now I'm there. I know why they were unable to do it. So all these things would make human contact a little less, but then you can still not totally avoid it.
Okay, thank you very much, Prof, for your input about if we can completely train medical health students without physical interaction. I mean, I brought in that question because of the trend in the internet space. Some of us may have heard about Web3 or Metaverse, where it's more like we are talking about 3D transmission. It's no longer about picrophone and just the audio transmissions. This time you can wear a particular tool and a 3D version of yourself will transmit to that place and interact with someone. And during the discussion, someone was like saying, is it possible that you can be in France and transverse, I'm using the transverse just to fix it in with the metaverse, just teleport to Nigeria to perform a surgery just by wearing that device and then finish performing the surgery and go back? And I say, well, you cannot even say everything is impossible or possible when it comes to the internet world, because things are really going advanced and advanced day by day, and we are just here looking. And we are wondering again, with respect to this internet technology, since it's the major changing factor, two relationships are important. One is the teacher-student relationship, and the other one is the doctor-patient relationship. In the health industry, do you think technology will hinder or hamper any of these relationships? Because we all know these relationships are totally essential for each outcome. The teacher-student relationship essential for the academic outcome. Then the doctor-patient relationship essential for the patient outcome. So, do you think in the internet, for example, the patient who chose to do online consultation, do you think the relationship between that patient and his or her doctor is reduced compared to when the person visits physically?
Yeah, I believe so. Answering the latter part of your question, there's no way looking at you on the screen, uh, which is, I would say, like a virtual thing, uh, and I'm talking to you, will be like you coming right, sitting right in front of me or lying on the bed, and I'm having consultation or treatment with you. In fact, you will know that in developed countries, it's becoming a problem now because everybody's like, you can get whatever you want online, and that human relation is thinning out. Of course, you should know that human beings are social animals. God created us as social beings, not to live in isolation. And of course, that's why the incidence of psychiatric, or let me say mental health illness, is increasing in those communities. That's why we have less of it here, because we tend to interact, because we are social beings. That's why it's difficult to live in isolation and do things only on your own. So it will impair that bonding between the doctor and his patient. But as for the learner and the teacher, there's a lot that can be achieved that can improve the relationship between the teacher. Now, with the in the 21st century, the tendency is to go towards curriculum review or curriculum change or curriculum reforms, so as to factor in the use of the internet. Now we want in the 21st century to utilize more of what is called web-based learning, because the kind of system we had during my own time, the teacher must come physically, give didactic lectures, and go away, you go back and read. If you are the hardworking type, you look for additional information. Now, the information that they were delivering then is at the fingertip. Just a palm top or a laptop or your phone, you can get everything they are going to tell you and even much more. And therefore, that interaction this time has to be short so that when they are teaching, because the curriculum reform has to do with the learner, the teacher, and the practice. Those are the three domains that have to be looked into. So between the learner and the teacher, the little, or I'm saying little because that time will be contracted. The time the learner and the teacher will have contact will be shorter, but it will be qualitative. In that instance, all they don't need to download all the barrage of information that is available on the internet to the candidate. All they need to do is to use real life examples or short videos, short talks that will bring out the core, the essence of that particular teaching, while they will go and add on all the theoretical information that may be necessary. So those are the things that can happen between the learner and the trainer. And of course, the trainers also have to be taught because as things are changing, they have to learn how to use the internet to teach. At the time, the University of Ibadan acquired a number of smart boards or whiteboards that you can click on it, the internet can pop up and you can go to any site. Many people could not use it. We had to be trained over and over and over. Even today, it has been run down. It has not been sustainable. So, and the mode or the modality of assessment will now be different from the type that we were taught with. And every teacher has to be taught all these things to know how to deliver the lectures based on current concepts, and also to be able to assess using the current concepts, which is what is expected in the 21st century. And the mode of teaching that is being looked at in the 21st century is collaborative teaching or integrated teaching. The University of Ibadan started that a few years ago. During our own time, when you were in preclinical school, you only do preclinical things like physiology, biochemistry, biostatistics, and anatomy, strictly so. The new concept in the 21st century is to integrate clinical into the basic sciences. That is, you show the students real life patients and you teach them about clinical medicine. You integrate the basic and the clinicals together. For instance, if you are teaching them about the physiology of the heart and the pathology of it should come in when the patient goes into heart failure, let them see what happens. So rather than just teaching them straight physiology and leaving it like that, you tend to appreciate and you become a better physician when you combine these two rather than doing them in silos or in isolation. So those are the changes that one will see in this 21st century, and to be better off. And of course, in terms of collaborative training, health workers work in synergy. You have the doctors working with nurses, with pharmacists, laboratory scientists, and things like that. But in their training, they are divided, they are isolated. Life is not lived like that. That's why I'm against parents sending their children to all male, all female schools, because in real life, they won't live like that. And that is why some of them misuse the freedom when they eventually get it. I have experiences to show for that kind of thing. So if you have a patient with cancer, for instance, if this cancer that you want to train the students about, let there be an oncologist, a basic scientist, an oncology nurse, an oncopharmacologist or pharmacist, and things like that coming together. Of course, their training will have different pathways, but there must be some meeting points where they come together in the course of managing that patient. In fact, in some places I've been abroad, no single specialty manages a patient alone. You bring in other experts. You may have a medical oncologist, a surgical oncologist, a nurse oncologist, a psychologist, all coming together to have a conference on the way to manage the patient, because every patient has their own peculiarities. Even though two patients may have the same disease, but the pattern of presentation and the management may be different. And that is what is bringing us into the era of personalized medicine or precision medicine, because every human being is different. Even Siamese twins are different. So these are areas that the 21st century medical education will have to address.
Thank you very much for the exposition. While we are talking, okay, someone else have been even saying thank you about that. Omo said, "Hi, nice to be here. Hi, thank you for joining in." Niyo Makinde said, "It is nice listening to our erudite CMD. Thanks, sir." Niyo Makinde, welcome.
Okay,
Thank
thank
you.
you.
And Timothy said, "Great exposition." Whoa, thank you. So someone shares the same sentiments with me on this particular exposition on integrative and collaborative learning. And I'm glad that UI is actually pioneering this, being a pace setter when it comes to this. Since UI have already started pioneering it and showing us that this can be done, because if not that you said it, I would have made my assumption that this is not the usual here. And I would ask, why are we not doing something like that? Why are we not integrating everything together? Especially with the current know that we have to get into, like, students have to get into the field to work with technologies, new items, new tools and machines that they will be getting used to. And somehow in the classroom, they're just taught and it ends there. Why are we not integrating? But now UI is integrating. And what do you think are the barriers or challenges to this new adoption that you people are doing right now?
Well, I have interest in curriculum development, and the curriculum that has brought in this integrated learning in the medical school, I was part of it under the leadership of Professor Lapa Delapa, the former provost. We got a grant called the Makato grant to do that for the University of Ibadan College of Medicine, which the National Universities Commission has adopted for all medical schools. To come up with curriculum is a very, very difficult thing. Very difficult. You need committed people and those who are learned in that perspective. Um, it's not been a common thing to have a medical education unit in our universities or in our colleges of medicine. In developed countries, there's a unit that their main or sole work is just medical education. They do research on it, they do publication on it, they apply it, and they train people on it. Uh, this is unavailable, and this is a big challenge because it's only when you have those who are experts in that particular area that you can optimize what they do. So that's a major challenge. And then, of course, it also costs money. Like I said, there was a grant that facilitated that of the University of Ibadan, which is a Mercator grant. It's not all the time that you get grants easily, especially there's no focus on such research in Nigeria educational system, I must say. Usually it's those who have the privilege of having gone outside the shores of the country and they've seen something like that and they took interest in it like I did. I took interest in it and tried to develop myself along that area. So until we start putting some of these things in place, it will continue to be a challenge uh, to getting this integrated system of learning done. And of course, political will and commitment of the leadership, because some people may not see it. It's like as it was in the beginning, so shall it be, world without end. They don't see the reason for it, but we have to go in tandem with the world because medicine is going, as I foresee, it become globalized. Uh, you see that at the time, if you go to England and practice, when you come here, you probably cannot fit in. But when you want to go from here to England, it also make you do some courses because of geographical incident. I mean, differences
Differences,
in
yeah.
incidence of diseases. But the way things will go with the globalized world now, you just have to learn everything together. So that if you take a medical professional from England and come and practice in Nigeria, they should be able to fit in with just little difficulty, probably at the beginning. Many of our nurses, many of our doctors are immigrating now, and they just give them a short course. Usually, and I want to emphasize that, is because of the level of equipment they have that we don't have here. But in terms of head knowledge, scientific knowledge, there's no difference. So at the end of the day, with this globalization of medical education, all of us will probably be playing on the same pedestal.
Oh, thank you very much for your answers. Thank you for the views you've given us, especially the practical views, having tested the waters. For many of us, I was just scrolling through the comments to see if there's any question there, but there is none from the comment section. Hello, visitors watching. Of course, you know who we have today, Professor Jesse Otegbayo, who is the Chief Medical Director, University of College Hospital, Ibadan. And today we are discussing on medical education in the 21st century. We have a couple of minutes before we go. So if you have any question on medical education in the 21st century, you can drop it in the comment section and definitely we are going to see it. And Prof, I am sure will attend to that. He's definitely answering with experience because he's a long time erudite scholar. So he's been there in educational courses and industry and everything that has to do with education. He has seen it in the previous century and he's currently seeing it in the current century. So he can tell you, look at what have changed, look at things we can adopt or do better and the rest. Good enough, his institution, the school aligned to his institution are also testing the water when it comes to these things in medical education. And we are happy to have that right now to be able to scroll through. Thank you, Prof.
Thank you.
Okay, no question from this end, just to be sure we are not missing out on any question. And
Maybe
if you
nobody
just,
understood. Maybe nobody understood all I said. That's why there are no questions.
no, I
Could
think
be
you
either way.
actually
Either they
handled
understood
it well.
everything or they didn't understand it at all. So they just let it go.
I think I understood it personally. I poured.
Okay.
So sometimes when you understand something, you're like, there's nothing else to talk about. You just handled it well. I think so. That's why I'm just scrolling through to be sure I didn't miss out on anyone. Because yes, these changes are wonderful, and if one is not evolving with the changes, you'll be left out. That's the truth, and that's why um, many of our healthcare professionals who emigrate are made to do some courses to be able to catch up. If our climb, if let me start with our nation before I talk about the continent, if we don't brace up with these changes, definitely will be left behind. And the part of the, for me, I think one of the biggest determining factors is actually the political will and commitment that you mentioned earlier. Because some of the people in there, like you, who are already harming the affairs, already know, yes, what is great to be done. But you need top management support and commitment to drive that ship from where it is to where it's supposed to be. Okay, I think we'll have a question finally. Emmanuel Jite said, thank you, sir, for this expository session. Please, I would like you to speak to the place of medical entrepreneurship in the training.
Well, thank you very much. I think a number of universities that I know have already introduced entrepreneurship into their training, even something much different from their line of learning. Uh, like somebody who is studying computer engineering maybe has to take courses in animal farming, kind of, so that if you graduate, you even if you don't get a job along the main line of your profession, you can start something as an entrepreneur. But in medicine, people tend to think that once you study medicine, you will practice medicine. However, we have some, at least I know some of my colleagues who are not into medical practice. They are either into politics or business or other things. In fact, there's one medical doctor who is a fashion designer and she's making it. So for entrepreneurship in medicine, if you're talking of practicing medicine, I think it's a good thing because they will teach you how you can set up maybe group practice or individual practice and know the business part of medicine, because medicine has its social part and its business part. Most of the time, we don't practice the business aspect of it. That's why many private practitioners don't succeed. I know quite a number of who have folded up their hospitals after starting because they have not been tutored on how to convert their skills into business. And of course, as part of what is expected of the 21st century in medical education, there's what is called the competency-based medical education, whereby you train them to have some skills. Because the way the medical school is, there are some students that are like a they're always at the back, and they may be brilliant. It's just that they don't think they need to. So it comes to written exams, they pass, but they don't have the required skills. So competency-based medical education will ensure that in terms of assessment, you assess those students in such a way that you know whether they are deficient in clinical skills or not. And with the use of clinical skills laboratory, where you can go on your own, learn how to carry out procedures, and you even have videos on YouTube and all over the internet on how to learn and acquire the skills. There's a difference between having or knowing the skill and application of it. So assessment, which is one of the things that has to be taught the teachers too. You have to know how to assess clinical skills. So entrepreneurship is very, very important because it's not everybody that will work with government. It's not everybody that will go into private practice, or some will go into it, and it's only your skills that you have that will
Yeah,
bail you out when
no
you go into
business
such
skills.
ventures.
Nothing. Okay, the questions are gradually coming. Meanwhile, are you the prof?
I'm there. I'm there.
Okay, thank you. Kehinde Adeba, you're welcome. Hello, everyone. Hi, Kehinde. Welcome. Thank you for joining. Omo Boshade, we understood all you said, sir. All right, thank you. Another question just popped up. Sir, is it possible to sell some of these ideas raised to the federal government of Nigeria to improve medical service? Is it
The
possible to
answer is
sell these
the answer is
ideas?
yes. The answer is yes. And I would say that we have technocrats in government who are aware of all these things. Like I said, and you also repeated, Sister Amaris, political will and commitment to carry out certain things. When absent, there's absolutely nothing you can achieve, no matter how brilliant the ideas are.
It's true. True. Okay, I think we may have to explore further on how to actually get this their commitment because it's a major issue for most concerns. You have beautiful ideas just dying off because someone who is meant to support or commit to that particular idea, the execution, is not willing. Okay, Abalis Caleb, you're welcome. Thank you. Say good evening, Prof, and thank you for your time. We go through rigorous exams to work overseas. What makes them have us go through this is the theoretical knowledge is almost the same. Um,
If the theoretical
okay,
knowledge
if
is
the
almost
okay, yeah, yeah. What makes them have us go through this if the theoretical knowledge is almost the same? Oh, okay. Prof, you have
yes,
the
the
floor.
answer is simple and straightforward. They believe that you are coming from a developing country and you are not likely to have all the things required for the standard of care that they want. Number two, they need to know that you know a bit about their society, which is different from where you are coming from. We talked about geographical medicine. For instance, in Africa here, you don't see frostbite. Somebody in Mexico can have a frostbite and you just stare at the patient, you don't know what to do. So they have to be sure. Why we know of the existence of such things, but we don't have experience in seeing them and in managing them. So they have to be sure. Then three, they have a standard that they have set for themselves as a first world country. And they know you are coming from a lesser country. Therefore, they have to bring you a little up, they have to task you to really know that is it really worth practicing on our soil. So they take you to all these rigors of the exams to shake you. And mind you, they don't like anybody to come and practice in their land. It's only when they can get the best. And when you are to get the best, the exams have to be more rigorous than for the ordinary. If you look at it, a Caucasian or an American and a Nigerian, your anatomy is the same. It's just the skin color that is
Yeah.
different. You have 5 fingers, they have 5 fingers. All the bones you have in your skull, they have too. The brain, the hemispheres are the same. Your medulla oblongata is the same. So there's nothing different. But in terms of disease patterns, there are some differences, and there's a standard they have set for themselves. The same reason uh, here, some people will decide to take their children to private schools or King's College, while some people don't mind Orita Mefa Community High School and things like that because that's what they can afford. They can afford to pay you heavily for this job, and therefore, to whom much is given,
Much is
much should also
expected.
be demanded, not just expected, demanded.
Demanded. Yeah. Thank you, bro. You know, when you were talking about being certain that the person can do this, a particular scenario just struck me, and it's common in some of our school environments where someone will say, "Yes, we did a computer course in school," and then you give the person a document to type. The first question is, "How do I even turn on this system? What do I even use to type?" And you ask again, "You said you did a computer training or a computer course in school." And they said yes. And you see the transcript and the person passed it. So somehow, I think it still boils down to that integrative and collaborative learning that you were talking of, where we are saying practice as you're learning. Don't just make it theoretical. Because these are the things. Yes, the transcript maybe say, "We did this," but with experience they may have had from people who traveled earlier, practically is not reflecting. So they don't want to have that experience. And you know what? Let everybody just pass through this training, write this exam, sit for the exam, and we'll ensure that, yes, you know what to do should the case come up. That's what I'm thinking.
You're right.
I think there's another question. The questions are just coming in small. And secondly, sir, I also think it is high time that medical training is all encompassing by bringing the students together, be it nursing students, medical students, pharmacy students. Well, yeah, just like you were talking. I think so.
Yeah, it's an opinion which is in tandem with what I talked about earlier on.
Yes, I think because the whole collaborative learning, when eventually you get into the hospital system, you work together. So why learn together? I think that's it. And no other question there in the comment section. No other comments. Thank you everyone for joining in. We, well, if I see your comment, I'll definitely highlight it. Thank you everyone for joining in, and it's been an enlightening session, a good one, where we have the handsome Professor Jesse Abiodun Olubanjo Otebayo. You know, I'm
What
actually
are your
stressing on that
yardsticks for
handsome.
being handsome?
Yes, now it's not there on the screen. I'm sure everybody will just agree with me in this case.
You're making me
Yes.
blush. Me.
So yes, we have reputable Professor Otawayo with us today. And of course, when we're giving out the praises, you know, it's not just flattering, that we are being factual with what we're saying. He is what he said he is. His answers all reflect the erudite scholar that we have all introduced. But I would just have to read through this for those who joined in late, so you just know more, a thing or more about our guest today. So Prof was born in Sekondi, Ghana on 17th December 1961. I have to mark this date in my brain so I can come for birthday cake.
Yeah, or you have to bring one.
I'll bring one and come for one.
Okay,
And then
so buy one, get one free.
he hails from Otan Ile in Ocean State. And his medical training journey started in 1989 when he got his MBBS from University of Ibadan. And then by 1990, he has completed his internship in Obafemi Awolowo University Teaching Hospital Complex. In 1992, he completed his National Youth Service in Nigerian Navy Medical Center, now Delta State. Then it was Bendel. Then, December 1992, he started his residency in UCH. And 1997, he won a foundational grant to study hepatitis B and C. 98, he completed his residency and obtained his fellowship, West African College of Physicians. That same 1998, he was immediately appointed as lecturer one in consultant physician and gastroenterologist in the Department of Medicine, University of Ibadan and University College Hospital. 4 years later, he became a senior lecturer. 3 years after that, a reader. And then 10 years from when he became a lecturer, he's a professor already. So from lecturer one, 10 years later, he's a professor. That tells you that a lot has been happening in the background, and that brings us next to his academic or research prowess, because definitely these are all that are needed to assess how fast someone should grow, to assess promotion and the input the person has been bringing. So we selected some of them to bring to you. In 2000, he was elected into the Association of UICC Fellows following his contribution to the research studies. 2002, he obtained a postgraduate certificate in gastroenterology at the University of Tel Aviv. Sorry, excuse me. Great. At the University of Tel Aviv. Then 2003, he completed a master's degree in chemical pathology and immunology at the ULAND. And then 2006, he was awarded the fellowship of um, which this is not English. I've been struggling with it.
Mhm.
That is a microbiology fellowship in Institute of Immunology, Luxembourg. And in 2009, he obtained the prestigious fellowship of the American College of Gastroenterology, United States of America, and he was the first in Nigeria to get that. 2011, he was awarded PhD by the University of Ibadan. And 2014, he got the Fellowship for Professional Exchange Program in Linguistics to study French in Ouagadougou by the West African Health Organization. He has taught and served as an undergraduate and postgraduate examiner in several universities and hospitals in Nigeria, Cameroon, and Ghana for MBBS, primary, membership, and fellowship exams. And he belongs to several local and international professional associations. He belongs to NMA, that's Nigerian Medical Association. He belongs to Medical and Dental Consultants Association of Nigeria, the Nigerian Cancer Society, the Society of Oncology and Cancer Research of Nigeria, the African Organization for Research and Training in Cancer, the Society for Gastroenterology and Hepatology in Nigeria, the European Association for the Study of the Liver, British Society of Gastroenterology, and the American College of Gastroenterology. One person, ladies and gentlemen. And he has attended and presented scientific papers across different continents. And he has over 90 scholarly papers to his credit available on research and scientific databases such as PubMed, PubGet, Medline, Biomed Experts, Lab Meeting, ResearchGate, Academia.edu, African Journals Online, and the rest. In University of Ibadan and the University College Hospital Ibadan, he has been in many committees and different roles. He has been in admissions committee, ceremonial, medical education technology, executive committee, curriculum subcommittee, departmental postgraduate committee, Jaja Clinic Board of Health, committee on reorganization of Jaja Clinic, among others. And he has served as the immediate past director of clinical services, research and training, the chairman, medical advisory committee, member, board of management of the UCH, and on 1st March 2019, he was appointed as the chief medical director of UCH. And this is our guest today, Professor Jesse Abiodun Olubanjo Otegbayo. Thank you, Prof. Again. Thank you. We are so happy to have you here. Oh, people are still sending in comments. They are also happy. You see, Chama said, joined into this session and thoroughly enjoyed the insights and forward-thinking approach. Thank you. Thank you, Shama Basi. Emmanuel Jite say, thank you so very much, sir. Ni, we are proud of you, sir. Kehinde, well done, sir. Everybody, including Stella Maris here, is singing. Thank you. Thank you very much, sir. We're happy to
You're
have you.
most welcome. Thank you,
Yeah,
everybody.
thank you, sir. So this brings us to the end of the show, and see you again, of course, when we have the next section. If you've not subscribed to our YouTube channel, please do well to hit the subscribe button down there. turn on the notification button so that as soon as we put up any content, you get to know. Our contents are usually revolving around online courses, online learning, medical education, and that's what you keep seeing there. This particular session was brought to you by Thumim NG. Thumim NG is an online learning platform, particularly for healthcare professionals. We have rooms for independent instructors to join us to teach. So you can join in to teach. And of course, be sure you have students to join in because we have a base of up to 15,000 healthcare professionals made up of doctors, nurses, lab scientists, and more. So whatever knowledge you have, do not resist coming to share. Even if that knowledge is non-medical, yes, you can share it. We have courses on parenting, we have courses on business growth, we have courses on digital skills, research, and the rest. So even if you think this is not a purely medically inclined course, you can come and teach. Aside teaching, you can also come and learn, browse through and learn, pick one or two courses and learn and expand your knowledge. And we also have some CME related courses or programs that we host, webinars, courses. You can access any of them. Some are free, some are just given at the token, and you can have them all there on our website at www.thumimng.com. You can see the scrolling content at the end of this, the bottom of this video. All the information you need to know about us are there in the website. So you can join us as an independent instructor. You can also come and learn. And if you have a survey that you want to be performed for you, we can also step in to do that for you across any part of Nigeria. Yes, we are boasting about that because we know we can do that and we have done that before. And we are all happy to have you here today. Thank you for your time. Thank you, our erudite scholar, our reputable professor, our home CMD who made out the time to stay here with us. Is more than an hour already. And I'm so glad to have you here today. So glad for this moment. And thank you for this time. Bye, everyone. Closing remark from you, Prof, if you have anything to say.
Well, my closing remark will just be that to thank you for making me a part of this wonderful program, like I said earlier, and also to encourage our colleagues in the health profession not to rest on their oars, because medical practice of tomorrow would not be exactly what it is today. And for us to be able to key into it seamlessly without much effort, so to speak, we need to prepare. Not to prepare is to prepare to fail. Things are changing, things are evolving. Our patients or clients are now getting to know more. So there's no limit to the knowledge base. We now live in a knowledge-based economy. So the more we acquire knowledge in our own chosen field, the better we'll stand out amongst our peers and to be there for our clients and patients. Thank you very much once again, Salamaris, and the entire team of Tumin for
Thank
inviting
you,
me.
sir.
I've
Thank
also
you,
really
sir.
enjoyed myself.
Thank you for accepting our invite. You're welcome.
Yes, I must also thank Mr. Damola Dibwalagun, my brother.
Yeah.
He has been chasing me probably since last year. And eventually, he practically put handcuffs in my hand for this. I told
Are
him
we
I
able
was
to
attending
make
a meeting in Lagos today, which I did. He said, okay, let's put it at 6 p.m. and can do it from anywhere, either your hotel room and all that. And that's
Yes.
exactly what I'm doing.
Oh,
Left to
oh.
me, I probably would have evaded it, but he handcuffed me practically to be able to
Ah,
respond for this. So
thank
thank
you,
you.
thank
I'm sure
you.
he'll be smiling wherever he is now.
Definitely.
And to say something concerning the conduct of survey for people, I would like to know more about that. Presently, I'm the president of Nigerian Society of Gastroenterology and Hepatology, and we are establishing a new research group on Helicobacter pylori and microbiota in Africa. I'm the one representing Nigeria, and I need to do a survey, but of course, it has to be budget friendly. So if you let me know, you have my email, I'm sure. You can
Definitely.
inbox me about the procedure to get it done.
Oh,
Thank you. This
trust
should
us.
have been a private discussion, but
We'll
as you
take up
mentioned
on
it,
that. Yes.
all right.
Thank you very much. Thank you very
All
much,
right.
sir.
Thank you. God bless.
God bless you too. All right. Thank you everyone for joining in. And that is it for today. Bye.